Approximately 2.3% of the population in the United States between ages 18 through 54 suffer from OCD, which outranks mental disorders such as schizophrenia, bipolar disorder, and panic disorder. According to NIMH.nih.gov, people with obsessive-compulsive disorder feel the need to check things repeatedly. The thoughts and rituals associated with OCD cause distress and get in the way of daily life. Obsessive-compulsive disorder can get in the way of living a normal life. In my speech, I will be discussing the symptoms, the causes, and the treatments of OCD. First of all, every mental disorder out there has symptoms, but none are like OCD symptoms. OCD stands for obsessive-compulsive disorder. Obsessive part is your thoughts. An example of thoughts would be thinking that the door is unlocked after you've locked the door. A couple other examples would be thinking that the oven is still on when you already turn it off, or that the cord iron is still plugged in when you unplug it. The compulsive part is your behavior. The action that the person would perform is checking the doorknob 5 or more times to see if it's locked. OCD is an anxiety disorder. You can't stop your body from performing those thoughts and behaviors. According to helpguide.org, published by Lawrence Robinson and Janine Sigan, last updated April 2014, there can be different types of symptoms of OCD, such as having the obsessive thoughts or just having the compulsive thought behaviors. Obsessive thoughts would be fear of contaminated germs, or fear of losing or not having things you need. The compulsive behaviors is double checking the oven or lights or the doors to make sure that it's off or on or locked. They also like to order and arrange things just so. So they have to have their cans alphabetical order or their closets color organized. They also repeatedly check in on loved ones to make sure that they are safe. In addition to the symptoms, causes play a major role in why people get OCD and why it affects the way people live. Causes can be easily noticed, but most people don't realize they have OCD until they are in their late teens or early 20s. In the article on MayoClinic.org, published by the Mayo Clinic, last updated April 2013, it explains what can cause OCD. Our biology can play a role in why people can get OCD. How our brain functions and possible genetic components also are important. Environmental factors play a key role too. We can get infections that can hurt our brain and they can cause OCD. Family history and stressful events can also trigger OCD. Even though there are a couple of causes for OCD, there are more treatments out there to help deal with the problems associated with OCD. In the article published on WebMD.com, last updated on June 5, 2012, they list many different types of treatments that are out there for helping cope with OCD. Doctors recommend cognitive behavioral therapy, which is also psychotherapy. They use a technique called exposure and response prevention. They apply the patient to the obsessive they have, but they don't act out on it. Medications that they require are also called selective serotonin reuptake inhibitors. A common word for that would be antidepressants. A type of that would be Prozac. As you can see, living with OCD can be a daily struggle to perform routine tasks. The causes of OCD are not exact, but the symptoms can be easily recognized. Doctors are still trying to figure out different types of treatments to help people live more of a normal life that have OCD. A girl named Lizzie with OCD from the age of 8 hopes to get her story out to give others hope as you can live a happy and fulfilling life with OCD. Her story was found on beyondocd.org, last updated June 2014. The struggle is real, as stated by J.J. Keeler. OCD is not a disease that bothers, it is a disease that tortures.